we have told there will be raga, there will be daha in the chakshu. So that will be relieved by proper Shirovirejana. And all those diseases or all those symptoms associated with Jatruta, that will be relieved by Shirovirejana. And next it is told that what kind of ahara can be given. Avidahi lakusniktam aharam jaske kalpet. And in such a person, in addition to these treatments, the diet should be avidahi, lakhu and snigdahara. The ahara should be avidahi. It will not should not cause vidagdavastha. It should be lakhu and snigdha in nature. So that is about dhumopahata lakshana and its chikitsa. So in chikitsa mainly vamana, kavalagraha, shirovirechana. These are the main treatment modalities told, and in addition to that, diet is also explained. And another thing which is explained in the chapter as such is the dagda caused by Ushnavata, Adaba, Shita Varsha, Anila, etc. And for that also treatment is told. Like in Ushnavata and Adaba, when that causes Dagda Avastha, then we have to go with Shita Kriya. And similarly, when Shita Varsha, Anila, etc. are causing Dagda Avastha, we have to go with Snigdha and Ushna Kriyas. Similarly, when there is lightning, all these conditions, when the dahana is caused by all those factors, it is told that if that person survives, then we can go for Sneha, Abhyanga, Parisheka, Pradeha, etc. That is also told in the chapter. When we deal with the burns, we will see different kinds due to different causes, different types of burns can occur. So these can be correlated to those modern aspects. Okay, that is what is explained in the chapter Agnikarma Vidhi. So next is about the modern correlation. Mainly Agnikarma in the modern view can be correlated to cauterization, that is the destruction of tissues by using hot instrument or electric current or caustic substances. Based on that, it is divided as electric cauterization, chemical cauterization and all. And the tool used for cauterization is called as cautery. There are various methods of cauterization, like as I have told, electric cautery, cold cautery, which is done by using carbon dioxide, then gas cautery, which is done by using specially controlled jet of burning gas, then solar cautery, corrigens cautery. So many different types are mentioned. In addition to that, different heat treatments are there, both superficial and deep. Superficial heat means in forms of hot water bottles, warm packs, heat pads. All these comes under superficial heat treatments. Similarly, deep heat treatments include this diathermy, ultrasonography, etc. That is, high frequency electric current is needed in diathermy, and this diathermy can be used to treat bursitis, sinusitis, all these conditions. It is indicated. It reduces the pain, muscle spasm, inflammation, and also helps in the healing. And the mode of action, it is told like when heat is applied to the body, there will be an elevation in the temperature, which in turn causes vasodilatation, and there will be increase in the uh, waste product elimination. Proper circulation will be means local circulation will be increased, and the metabolism will be proper, and thus in turn there will be reduction in the pain, and it will promote the muscle relaxation, and so it will help in relieving the pain, will help in relieving the muscle spasm. It acts as an analgesic, and healing also will be, because of good circulation, healing also will be accelerated, and so it can be used in chronic inflammatory conditions also. That is about cauterization. Next is moxibush, that is a traditional Chinese medicine technique which also involves the burning of a drug. A drug in the sense a small spongy herb called as mugwort or Artemisia vulgaris. So that drug is burnt, and it is burnt and kept on specific sites of the body to facilitate healing. So it is the purpose of moxibustion. It is like to strengthen the blood, to stimulate the blood flow, and to maintain general health. And this therapeutic procedure also parallels Agnikarma in approach. So I have taken that also. And the method is told like the dry powder of the leaf of this drug, Artemisia vulgaris or moxa, that is used here, and hence the term or the method is termed as moxibustion. It also serves as a purpose similar to acupuncture only. That is, the application of heat over the painful area in the body. It helps in relieving the pain. And especially the center of painful area is selected, and their heating is done, and hence the results are much better. uh, it is also known that it will increase the number of red blood cells, it will increase the percentage of hemoglobin in blood, etc. are also told. And in the picture you can see, that is, the leaves of Artemisia vulgaris are dried in sunlight, and it is powdered, and it is uh, got into a wool like texture. And this material known as moxa wool is kept over the site of the body, and heating is done. That is moxibustion. Next is about burns. Burns, by definition, it is defined as a wound caused by exogenous agent leading to coagulative necrosis of the tissue. And there are different causes of burns, like open fire while cooking in the field, by means with boiling liquid, burns can occur. Electrical, acids, different causes are told for burns. And based on these causes, like what means, if it is from direct burning fire, if it is caused due to any chemicals, if it is caused due to any electric current or something, based on that classification is done. Different types of burns are told. First one is thermal injury or thermal burns. Thermal burns include the scar, that is spillage of hot liquids, then flame burns, then flash burns like exposure of natural gas, combustible liquids, contact burns. All these comes under thermal burns. Next is electrical burns. Electrical burns, that is accidental electrical contact, and that depends, that severity of the burn depends on the strength of the electrical voltage. There is low voltage and high voltage, and based on that the severity may vary, and the duration of contact also determines the severity. That is electrical burns. Next is radiation burns. UV light, X-ray, radiation therapy, all these can cause radiation burns. And the effect means, the effect of the burn is determined depending on the amount of exposure to the area. That is almost similar to the other thing also. The duration and the exposure will determine the severity of the radiation burn. Then chemical burn means burns due to strong acids or strong bases. And in chemical burns, the tissue destruction is more and progressive, and it is always a deep burn. That is chemical burn. Then cold injury, it is due to long-term exposure to cold or low temperature. Usually affects the fingers, toes, nose, and ears. There will be numbness, pallor, severe pain, and etc. at the site of exposure. And intervention, it is told like we have to warm the area rapidly and continuously. Inhalation injury. Inhalation injury, that is what is correlated to dhumopahada. And in inhalation injury, it has significant impact on the survivability of a burn injury. That is, it has three components: carbon monoxide intoxication, upper airway swelling, acute respiratory failure. So these three components, it can occur alone or it can occur in combination. So if these components are not that much severe, if it is occurring alone, in such conditions, the survivability will be more. The condition will not be that critical. But in conditions where all these three components are occurring in combination, and that too in a severe form, then that the condition will be life threatening. So based on that, the inhalation injury can be inconsequential as well as it can be life threatening also. That is inhalation injury. Then next is about the classification of burns. So classification of burns depending on the thickness of the skin involved. Based on the thickness of the skin involved, that is, different layers: epidermis, dermis, subcutaneous, fat, muscle, all these layers are there. So based on the layers involved, the burn is classified. And first classification is like first degree. First degree means Here the epidermis looks red and painful. The epidermis, the topmost layer, looks red and painful. There will not be blister formation, and the burn will heal rapidly in 5 to 7 days without any complication like scarring and all. It will heal within 5 to 7 days. That is first degree. Next is second degree. There, the affected area will be mottled. There will be red, painful blisters will be present, and it will take much more time to heal. That is around 14 to 21 days will be taken for the healing. And next is the third degree. Third degree means the affected area is charred. That is, that much burn have happened, and there the area will be painless and insensitive, and the intervention also will be, it will be requiring grafting and all. That much severe burn might have happened. That is the third degree. Fourth degree means the underlying tissues are also involved, like muscles, bones, all these are also involved. That is considered as the fourth degree. That is burn classification depending on the layer of skin involved, or the depth of the skin involved. Okay, first degree, second degree, third degree, and fourth degree. Again, this based on the thickness of skin involved, there is two classifications like partial thickness burns and full thickness burns. Partial thickness burns means it is either the first or second degree, where there is red and painful, often with blisters. But full thickness burns means it is the third degree where, or fourth degree, where there is charring of the skin. There will be insensitivity, there will be all those complications will be associated. That is partial thickness burns and full thickness burns. That is also a classification on the basis of the thickness of skin involved. Another thing is the severity of the burn. Based on the severity of the burn, there is burn severity is assessed like mild, moderate, major, etc. Mild or minor, that is condition where means based on the percentage of burns it is assessed. That is, in a superficial burn, if there is less than 50% of superficial burn, then it comes under the minor category. Similarly, when the partial thickness burn is less than 15%, that is also considered as minor or mild category. And full thickness burn less than 2%. All these three comes under the heading mild or minor. Next is the moderate. That is, depending on the percentage of burns, the burn severity classification is done. Burn severity classification is mild, moderate, and major. And on the basis of the percentage, we are classifying it under these headings. So we have seen about mild. Next is moderate. Moderate, the superficial burn if it is greater than 50 percentage. 50 percentage of the body surface area, that is BSA indicates body surface area. So if the burn is greater than 50% in the superficial case, that comes under moderate. Similarly, partial thickness greater than 15% and full thickness greater than 2%. All those three come under moderate. Third one is critical, major or severe. In that, the partial thickness greater than 30%, full thickness greater than 10%, and inhalation injury. Those three are included under critical or major or severe category. That is the classification of burn, burn severity classification depending on the percentage of burns. So that is another classification tool. Next, it is about the assessment. Assessment of burns, there are different techniques tool like Wallace's roll of 9, Lund and Browder chart. Another is patient entire hand area. That is, the entire hand area is taken as 1%, and a clean piece of paper is cut to the size of the hand, and through that the percentage of burn is assessed. That is, that area is taken as 1%. So, and a piece of paper is cut in the shape of that area or according to that size, and with that paper we will assess the percentage of burns. These are the three methods widely used for assessment of burns: Wallace's rule of 9, Lund and Browder chart, and this area of palm, entire hand area when taken as 1%, and that is assessed. Next is about the pathophysiology. So in the pathophysiology, when we see, this is the Jackson's theory of thermal moves. Jackson's theory of thermal moves means When a burn occurs on the skin, it causes changes on within the skin, and that could be divided into sort of three regions or three zones. These zones of the burns are described by Jackson in 1947, and so it is called the Jackson model or Jackson's theory of thermal wounds. The first zone is the zone of coagulation. Then it's the zone of stasis on the outside, and further part is the zone of hyperemia. So these are the three zones. Zone of coagulation is essentially the point of maximum damage. In this zone, there is irreversible tissue loss due to coagulation, and there we will get the coagulative necrosis. That is about zone of coagulation. Next is zone of stasis. Stasis zone is essentially characterized by decreased tissue perfusion. This ischemic zone may progress to full necrosis unless the ischemia is reversed. That is about stasis zone. Next is the third zone, that is at the outside. It is the zone of hyperemia. In this zone, tissue perfusion is increased and the tissue here is invariably recovered. It is the last zone, so it is invariably recovered unless there is severe sepsis. If there is severe sepsis and all, there also the tissue destruction will be more. But other than that, it is invariably recovered. If there is no severe sepsis or prolonged hypoperfusion, that zone is told like there will be increased tissue perfusion and the tissue here is invariably recovered. And when we see the zone of stasis, that stasis zone is characterized, as I have told earlier, that stasis zone is characterized by ischemia and it may progress to full necrosis. If the ischemia is not reversed at proper time, then there will be full necrosis, complete tissue death will be there, and that will lead to further complications. So, therefore, the main aim of burn resuscitation is to increase the tissue perfusion at this zone, and we have to prevent the further damage. That is told by Jackson. That is the Jackson's model. So, here in the pathophysiology, if we see, this can be taken as two, that is in the left side it is about the superficial burn, next is about the deep burn. In the superficial burn you can see superficially the burn is happening, and because of that there will be damage of the keratinocytes, and there will be immune response, that this the mast cells, all those cells will act, and there will be a release of cytokines. This cytokines will act differently, like the cytokines will stimulate the nerve endings and it will cause pain. The cytokines will increase the vascular permeability, and thus the fluid will be shifting from the vessels, and there will be hypotension, there will be vasodilatation, and sometimes there will be blister formation due to this increased permeability. So these and all will be happening in the superficial burns. In the deep burns, directly there will be destruction of the blood vessels, which in turn will cause all these features like hypotension, interstitial edema, increased vascular permeability, all these will happen. So, as a whole, when the pathophysiology of burn is taken, the heat will cause coagulation, necrosis of skin and subcutaneous tissue. And as a result, there will be release of certain substances like vasoactive peptides and all. And there will be alteration in the permeability. There will be loss of fluid from the spaces. And finally, it will cause severe hypovolemia. And this hypovolemia will in turn lead to damage in other systems or other major organs. Like this severe hypovolemia can cause decreased cardiac output, it can cause decreased renal blood, and some cases there will be infections also. So further, these systems or these organs will develop damages, and in case of infection itself there will be sepsis. That sepsis can in turn affect the different systems. And finally, when there is severe sepsis, when there is septic shock, there will be multiple organ dysfunction and it can lead to death also. That is the pathophysiology. So this is the process what is happening in the burn. So there will be, due to the heat, there will be coagulation necrosis, there will be a release of vasoactive peptides. Because of that release of these substances, there will be altered capillary permeability, loss of fluid will takes place, and that will cause a severe hypovolemia. This hypovolemia will in turn act on different systems like decreased cardiac output, decreased renal blood, major systems will be affected. And if there is infection, that also can lead to different system involvement. And finally, it can result in multiple organ dysfunction and even death. Then how this systemic changes, like pathophysiology, we have told that what is happening in the pathophysiology. Now it is how the systems are differently affected. That is, in severe burn, there is altered hemodynamics. There will be fluid electrolyte imbalance. There will be hypermetabolism. So metabolic changes will occur. The increased gut mucosal permeability that will causes GIT changes, acute gastric dilatation, paralytic ileus, all those GIT changes will occur. Decreased renal blood flow. So renal changes will occur. Immunosuppression. Infection will be more prone. Then vascular permeability and edema. That is, in turn, there will be massive edema in the body due to this altered pressure gradient and all. So many systems will be affected due to the burn. So as sum up, if we tell, the effects of burn injury will include shock. It can include renal failure, respiratory failure, infections which can lead to bacteremia, septicemia, etc. GIT can be included, means involved. Fluid and electrolyte imbalance occurs. And locally also, if we see, there can be, means at the site of burn, there can be formation of keloid, formation of contractures, Ishar formation, fractures in case of electrical injuries. Different kinds of effects can occur based on the severity of burn, or based on the exposure and contact, there will be different effects. Next is about the management. First thing about the management is the first aid. First aid is like, we have to stop the burning process, and the patient should be kept away from the burning area. And next thing is, we have to cool the area with the, means burnt area, with tap water by continuous irrigation for about 20 minutes. We have to use tap water, not cold water, because cold water can cause hypothermia. And next is about the definitive treatment. That is, we have to admit the patient to the hospital. We have to maintain the airway, breathing, circulation, all those are the treatment. So first is about the first aid. And in first aid, I have told, first thing is, we have to stop the burning process, or we have to keep the patient away from the burning area. And the area which is burnt, that area have to be cooled by continuous irrigation of tap water for about 20 minutes. And definitive treatment is like, we have to admit the patient, and we have to maintain the airway, breathing, circulation and all. And next is the percentage, degree, type, everything have to be assessed. And always keep the patient in a clean environment, because the chance of infection is high. So always the patient have to be kept in a clean environment. And as there will be associated pain, all those discomfort, better to give the patient sedation and proper analgesia. Then fluid resuscitation, of course there is hypovolemia, so we have to go for fluid resuscitation. Then to monitor that input output and all, better to go with urinary catheterization. Then tetanus toxoid can be given. Proper monitoring of the patient, like BP, uh, oxygen saturation, everything have to, pulse rate, everything have to be monitored at regular intervals. Then Ryle's tube insertion can be done, because first it is to be done to do the aspiration, and later for feeding also Ryle's tube can be inserted. Then antibiotics, as the chance of infection is more, antibiotics can be started. Then there will be, means for faster recovery and for the improvement of general health of the patient, better to go with TPN, that is total parenteral nutrition. Then if there is respiratory involvement, or if there is any other respiratory failure impending, there is, if chances are there, then we can go for tracheostomy or intubation tube, and intensive nursing care is suggested. And then about the local management, like dressing, using different means app drugs. Dressing can be done, that can be done in open method and closed method also. Open method means without any dressing, local application of sulfur in such drugs can be done, especially in burns of face, head, and neck. Open method is advised. Then closed method is like after application of ointments or something, dressings will be done. Then skin grafting, then mesh skin graft, all those things can be done according to the severity of the condition. Excision of burn wound with skin grafting, all these techniques have advised. Then slough excision have to be done. So slough should not be kept at that area. Regularly, that slough have to be excised to promote the healing and to promote the growth of new tissues, healthy tissues. Slough excision have to be done. And next is ischorotomy. Ischorotomy means eschar formation means there will be scab formed at the site of burn. That is charred, denatured, full thickness, deep ones with contracted dermis. It will be insensitive. That will form over the area. So that will be thick. And so that is called Ishar. And that there we have to do longitudinal full thickness incisions. That is to prevent collection of edema fluid under that area, because there will not be, because of this Ishar formation, the fluid will not get outside. So to prevent that collection of edema fluid, we means if required we have to do deep longitudinal full thickness incisions. The site is given there in the picture. So that process is called ischorotomy. That have to be done if there is Ishar formation, and to prevent that collection of edema fluid and to prevent the compression of vessels. When the edema fluid gets accumulated, that will cause damage to the adjacent structures. So to prevent that compression of over the vessels and to prevent the collection of edema fluid, we can do incisions, deep longitudinal full thickness incisions in different areas accordingly. That process is called ischorotomy. That is also a management technique. Similarly, multiple incisions or incisions over joints whenever it is needed, that also can be done. Next is the contracture. Contracture in the wound means there will be tightening or shortening of the tissues due to the damage of the tissues or the burns involving the muscles, tissues, etc. There will be tightening or shortening of the involved tissues. That is called contracture. So that burn wound will be contracture will be present in that burns. Mainly, it was affecting places like joints, eyelids, cheeks, etc. So in the picture, you can see the knee joint is affected, the face, chest region, all those places there is contractures present. Contracture is of two types. It can be intrinsic and extrinsic. Intrinsic means by the loss of tissue. When tissue loss is happening at the site, that because of that there will be tightening. That is intrinsic. And when during the process of healing, that healing phase, when there is pull, that can cause extrinsic contractures. So that is about contracture, which is a complication of burn wound. And this there can be complications for this burns contracture. That is due to this contracture, other complications can occur. That is in this picture we can see, that is in the eyelid there will be ulceration, there will be keratitis and disfigurement of face. In certain cases, when mouth, that region is much more affected, there will be narrowing of the mouth. Then when there is contracture in the neck region, there will be restricted neck movements. Similarly, the joints when affected, it will lose its ability to function. The joints will become non-functioning. And other complications of the contractures is like keloid formation. There will be hypertrophic scar formation. Then ulcer over the contracture, that is Marjolin's ulcer. So these also can happen over the contractures. For contractures also, different types of surgical procedures like skin graft, plasty, etc. are mentioned. And for facilitating the movement, proper physiotherapy, rehabilitation, etc. are advised. Then to prevent the hypertrophic scars and all, pressure garments are told. And in addition, if there is itching and all, accordingly medicines can be prescribed. That is about burns. I think in the notes, detailed description about other types of burns is given. So in total, today we have discussed about Atmakarma as such, the detailed description given in Sushruta Samhita. then about its modern correlation, that is cauterization, then about moxibustion, that is a Chinese traditional technique. Then we have seen about burns in detail about each type of burns and all in the notes it is given. So that is about today's class. Any clarifications needed?
Ma'am,
Yes.
Basuravarna,
Actually, it can be taken as in some cases it is red hot. Okay, that much uh, heat should be applied over the surface, and that redness is indicated by that. Practically, we in some cases we will keep the shalaka till it becomes red hot. Some
Binna
cases depends.
Costa, ma'am. Binna
Pardon?
Costa, ma'am. Binna Costa.
Bhinna Koshta means internal bleeding conditions, because when you learn about Brana in detail, you will see about different kinds of Branas. That is by different traumas when Branas occur, when wounds occur, in that internal bleeding, when there is injury to the Koshta and all. That time internal bleeding, that conditions are given under Bhinna Koshta. All those disorders which causes internal bleeding, internal
B,
injury.
ma'am,
Pardon?
Biru. Biru.
Biru means coward, means fearful person, means who's having fear for everything. Those are like means whenever we discuss about the procedures, mainly those kind of persons are contraindicated. This Durbala means weak patients, means by health or mentally also they will be weak. They will not be having that capacity to face the procedure. So the desirable result will not be obtained.
Ma'am, Tarka is contraindicated in your notes, ma'am.
Pardon?
Tarka.
I'm not. One second, you just tell.
Tarka, those are Patya, Apatya, ma'am.
Patya Patya.
Ha, yes, ma'am.
Let me see.
In the slide, 7th slide, ma'am.
Okay, let's see. In the notes, you are saying
Yes, ma'am.
uh,
When
that
I'm
is
reading,
uh, that is after the process, means this Agni Karma, after the procedure, we will take the local site as a Vrana only, because we are creating a Vrana, right?
yes,
So,
ma'am.
according to those descriptions given in Brana chapter, same things can be adopted in this patient also, because after Agni Karma, the patient have developed a Brana. So, there in Brana chapter, it is told that the substances like the Di Takra, means all this will cause Vidagdha Avastha, that will cause uh, production of pus. Those substances are like they will increase the production of pus. So it is told like we have to avoid the substances like the D-takra, etc. That is told in the note. That is separately told. As such, there is no direct mentioning of that Patya Vatya. But when we consider that Agni Karma Krita Vrana as a Vrana as such, we can take the Patya Vatya mentioned for Vrana separately. So whatever Patya Vatya is told for Vrana, that same can be applicable here also. That's why that the Ditakra etc. are mentioned. As such, in Agni Karma chapter, it is not told about Patyavatya. Only thing is we have to give Pichilanna for conditions other than Mudagarbha, Ashmiri, Udara, etc. That is only mentioned about this Agni Karma means diet. Other than that, direct explanation is not given regarding Patya and Apatya.
ಮ್ಯಾಮ್ ಇತರ್ಥ ದಗ್ಗ ಅಂತಂದ್ರ
Itaradha Dagda means in we have seen that Ushna and means Ruksha and Snigdha Dagda, right? So in the chapter it is like other than this Dagdas we have to like Tok Dagda, Mamsa Dagda. Other than that, another shloka is told like Snigdham Ruksha based on the dravyas used. There is another that is already we have told in the classification portion, that is there is another classification regarding the drugs used, that is Snigdha and Ruksha. Same is given under the heading Itarada Dagda. Itarada Dagda means something else which is told that when you see the chapter Agnikarma Vidhi, you can see that there is mentioning of that sloka. Tatra snigdham ruksham va cha ashritya dravyam dahati agnisandapto hi sneha sukshma siranusarita. That there it is told like snigdha dravyas when we are using for Agnikarma, that will uh, cross through the sukshma siras. Because of that quality of that snigdha dravyas, it will enter into sukshma siras. That minute vessels or minute structures also will be afflicted, means will be affected by this snigdha nikarma, and hence that sneha dakta will be having severe pain. Such a description is given in the text. So you have to understand that idarada dagda is snigdha and ruksha dagda.
yes. And ma'am, when some usually karmas agni or shvedana is samyak agni karma. Ma'am. So how to know when to stop the agni karma procedure when starting?
Means practically you are asking.
Yes, ma'am. I don't.
Okay, fine. If needed, I will try to give the videos. Okay, if you have not seen, I will try to give the videos. But the thing is, uh, mainly we will means according to the means mostly when we practice and all, we will see that it will not be that much deep. And according to the we should not go for that much adidagda avastha. Okay.
Yes.
While applying that itself, we will get to know. Means by practical application only, we will come to know how much deep it is, how it can be done, and all. But if possible, I will try to find out video and will show you. Okay.
Usually,
We have
ma'am,
to take.
pain and swelling depending upon the degree, ma'am. So when to stop degree and how much that one I'm saying.
You mean when to stop?
When
See, means while we do only, we will understand that how the means depending on the condition, we will select the site. Depending on the severity of pain and all, we will decide. Means if it have to be Tokdekda, while doing the procedure, we will get to know how much deep it should be. Then we will be having an idea on how much deep it should be. And if in case of severe and based on the shalaka used, I have told you different types of shalaka is being used. So based on that shalaka also, we can assess the depth by seeing only. Mostly we can means it should not be that deep. Means the heat also, there is a particular time for the sustaining of that heat. So that also we will see, and practically while doing, we will assess that like that. As such, we cannot tell that the timing, or we cannot tell as such.
we stop, ma'am, when usually the shalaka will be hot, ma'am. That time
Yeah.
you
So
put
means it will be
that
red
area.
hot. Means if we are too much pressurizing and all, that will cause deep burns. So it is according to the condition. Sometimes we will just pinpoint. In some cases, that is only needed. In certain cases, we will not wait for that red hot appearance. And after keeping the shalaka, we will be heating the shalaka. Right after we will once we will mark the place, mark the point where there is maximum tenderness, then we will uh, point that shalaka, and after keeping the shalaka, we will burn the shalaka so that the heat is transmitted through the shalaka. That is also another procedure. So it is one thing is based on the tolerance of the patient. Some patient will not tolerate even minimum pain, means minimum heat. such cases also there is difference based on the heat tolerating capacity. Also there is difference in the time period and all. So different procedures are advocated for the same. Depends on that. Means if it is red hot shalaka and if we are keeping for so much of time, one thing is the patient will not sustain that heat. Second thing is it will cause adverse effects. So accordingly, we will decide.
Ma'am, when the patient not tolerate the pain, ma'am, you can postpone the day also, ma'am, to the next day.
Sometimes we will do, means in some cases we will see in certain cases like lower back pain also and all, immediate relief is obtained. That is once we apply that Agni Karma, when the Agni Karma procedure is almost done, the same after, just after the application itself, we will find relief. In such cases, or in cases like uh, when the when we feel like the adequate procedure is not done, sometimes we will keep at the same day, and if morning it is done, we will keep another sitting for in the evening also. Such in such way also we will keep the procedure. And in other cases we will try to do once in a week, or with a 2 days gap we will repeat the procedure.
Okay, ma'am. Ma'am, Ishar, you say, ma'am, in horizontal way.
Yeah,
Ma'am, how to insert the instrument and how to the treatment, ma'am, it's not
that is
understand.
Ischirotomy means the thing is that will be a thick layer is formed. That is a scab, thick layer is formed over the burnt surface. So because of that, we means normally if there is fluid accumulation and all, it should be removed, or it should find a way out. So that will not be happening due to the thickness of the skin over the surface. So for that, over that area, we will, normally it will not happen. So surgically we will be keeping incisions in that itself. See here. So in this image, it is told different regions are told, right? Certain regions are marked. See in the upper lip, in the chest region, how it is. Means that markings is the how to perform the ischirotomies. So as I have told, Ishar is something which is it's contracted dermis. There will be thickening. So from there, there will not be means removal of that fluid will not happen. So there will be accumulation of fluid, and inside edema will happen. Edematous fluid will be there, and when this fluid accumulation happens, there will be compression, and compression to the adjacent structures, and this compression will lead to ischemia, gangrene of other parts. So that's why we go for ischorotomies. So if we are not doing that, and if inside that fluid accumulation is happening, there will be complications. And so to remove that fluid, or to remove that to prevent that collection of edema fluid, we are doing deep longitudinal incision, full thickness incision. That is, full thickness incision means we have to go deep till that accumulation level. So where the accumulation of fluid is happening, that much depth, longitudinal full thickness incision have to be done. The parts we have told, means you can see the markings, means how much longitudinal means how much it is done. It should not be zigzag, because when ischorotomy is done, there will be uh, chance of injury to other structures, nearby structures. So we are telling that with proper care, longitudinal incisions are done, by making sure that there is no injury to, means avoiding the injury to major nerves and vessels of the region. We should do deep incisions, so that we will remove the collected fluid inside, and thereby we can prevent the compression of the vessels. And during ischorotomy there will be large quantity of blood loss also. So we have to, means that much deep incision we are doing, and that too a longitudinal a lengthy incision. So we have to make sure that the blood loss which is happening during ischiotomy, that is maintained by blood transfusion. And always the incision should be of adequate length and depth, because we have to make sure that the purpose is served. We have to remove the fluid, so it should be of adequate length and depth according to the Ishar form. Means it may vary. We cannot tell that in all places, in all patients, in all burns, the same thing will be happening. So based on that, the incision have to be decided. In cases if needed over the joints and all, multiple incisions are also advised. Okay. In some cases, the ishar itself is removed. That ishar can be that thick portion will be excised, and skin grafting etc. will be done. That depends on the condition. That is about ischarotomy.
Ma'am, Rule 9, once again, to tell.
Rule of 9 means that is the method of assessment actually. So the percentage, as I have told in the treatment portion also, when we see, it is important to assess the burn, means how much percentage or how much area is affected, that we have to know. Then only we can treat the condition properly, because based on the percentage of burn involved, all those things we will assess the condition of the patient. Accordingly only treatment can be done. So for assessing the burn, this rule of 9 is true. Rule of 9, it is given the name because in this picture you can see the anterior and posterior aspect is taken. So first is head region. Head region, then head and neck region. The first in the picture you can see the head and neck region is taken, and it is told like the head and neck region totally it is 9%. That is when the burn is happening in the head and neck region. If it is in the anterior aspect, it is 4.5 percentage. If it is in the posterior aspect, it is 4.5 percentage. So when the burn is happening in the head and neck, it is given 9%. Then if there is burn in the front of the chest wall and the abdominal wall, again 9 and 9. Chest wall it is 9, abdominal wall it is 9. So when burn is happening in the chest wall, again 9 is added. Then if there is burn in the front of abdominal wall, again 9% is added. So now if there is burn in the head and neck, front of chest, front of abdominal wall, we have added 9 plus 9 plus 9. Then when we consider the posterior aspect, posterior back of chest and abdominal, similarly 9% is added. Then next is the lower limb. Lower limb, again it is 9 in one lower limb. Means first portion, means front portion 9, and then next lower limb total it is 18 into 2. The lower limb it is 18 into 2. 9 into 9 means 4 nines. One portion means upper portion and lower portion 9. Total it is 18. So there are 2 limbs. So it will be 18 into 2. So in the lower limb alone it is 36%. Upper limb as a whole it is taken as 9 into 2. That is 9 for one limb. Similarly, 2 limbs it will be 9 into 2, that is 18%. And the perineum region in the diagram it is shown, it is taken as 1%. So when we add these all the things together, we will get 100%. The total body surface area is taken as 100%, and accordingly the percentage is given. So when a burn is happening and when we are assessing the patient, according to the regions affected, according to this rule, the head and neck 9%, front of chest and abdominal wall 9 into 2 18%, back of chest and abdominal wall 9 into 2 18%, lower limb 18 into 2 36%, upper limb 9 into 2 18%, and perineum 1%. Totally it is 100%. Like that we can assess the percentage of burn in the patient. Is it clear?
Yes, ma'am. Ma'am, pathophysiology once, ma'am. That is enough.
Pathophysiology, as I have to. One thing is 3 zones, that is okay. In the major pathophysiology, we will see. Uh, First, I have told about that superficial and deep burns, right? So, superficial burn, when you see the left side, superficial burn is happening, and then there will be damage to the keratinocytes, the cells present over the superficial surface of the skin. There will be damage, and in turn, as there is damage, the immune response will be activated, and there will be the cells like mast cells and all those immune uh, related cells will get activated, and that will in turn cause the production of certain cytokines. These release of substances that will lead to certain symptoms, or that will cause some changes inside, and some symptoms will be appearing. So these cytokines, the means so much of substances are released, and some cytokines will act on the nerve endings. Nerve endings means it will cause the pain sensation. When the cytokines act on, or it stimulate the nerve endings, it will cause pain. Next, it will increase the vascular permeability. That is, when the vascular permeability is increased, the fluid shift will be increased. That from the inside of the vessels, the fluid will be shifting, and that will cause in the spaces and all fluid accumulation will happen, and that will cause edema and all. Similarly, when the fluid is moved upwards, there will be blister formation. When the fluid accumulates in a particular region, there will be blister formation also. So that is another symptom. Similarly, these cytokines will act on the blood vessels, and it causes vasodilatation, and that will further lead to symptoms like warmness, blanching, erythema. All those symptoms will be caused due to those changes happening inside. That is what is happening in superficial bonds. And when in deep bonds, what is happening is directly there is destruction of the blood vessels. In superficial burns, due to the action of cytokines, this is happening. So here in deep burns, it is like due to the deep burn, directly there is destruction of the blood vessels, and because of that, almost same features, but there is no moist appearance will not be there. So that is what is happening in superficial and deep burns. Is it clear till that, or was there any break during that? Should I
Wait,
repeat?
ma'am. It's okay, ma'am. I will check.